Afternoon. We now have 3 vaccines in the fight against COVID-19. The Food and Drug Administration has authorized emergency use for the Johnson & Johnson vaccine. Here to tell us more about the vaccine is Dr. Daniel Gottschall. Thanks for joining us this morning, Vice President of Medical Affairs with Hartford HealthCare St. Vincent Medical Center. Thank you.
Thank you for having me.
Absolutely. So first, let's talk about what makes this vaccine unique from the other 2 that's already being distributed, meaning Moderna and Pfizer.
You know, there's 3 major things, but I think the things that are most important to people is, number one, it's 1 shot instead of 2 shots. It can be stored a little bit more easily, so that means it's going to be more readily accessible to people. And of course, the third thing is just the mechanism of how we get our body to create antibodies, which is what we're doing, what a vaccine's job is, so that it kind of teaches our body to make an antibody so that when we see the infection, we can fight it. Those are the 3 major things.
Absolutely. And doctor, I know some people may be worried about the effectiveness of this Johnson & Johnson shot, being that it is only 1 dose. Can you tell us how effective is it? What have you learned about the side effects? Tell us.
Yeah, so in the studies, actually, it's very effective. So it looked like the most important things that they looked at in this particular study, which was basically, number one, it was 85% protective against severe disease. And the other 2 takeaways is that in the study, the people that got the vaccination, nobody died and nobody was hospitalized. So in the United States, it was 77% effective at mild or moderate disease. But the most important thing is what we're looking the vaccine to do is prevent you from getting really, really sick, prevent you from going to the hospital, and certainly prevent the people from getting sick enough to actually require going into the ICU and even possibly dying. And this vaccine absolutely did that.
Absolutely. And that's specifically talking about the Johnson & Johnson vaccine, which was just authorized for use. But what is the message, to people who have not yet gotten the COVID vaccine because maybe they don't believe in it, are afraid to get it?
Listen, we see in Connecticut, close to 20% of people have been vaccinated. We know because of this, we're seeing less and less infections. Our hospitals are less filled with COVID-positive patients. Our recommendation continues to be this is a safe vaccine. This is an effective vaccine. It's going to be safe for you. It's going to be safe for your family. The peace of mind that my colleagues and I have, the fact that we were fully immunized, that I can't get my colleague sick, that I can't get my patient sick, that I can't get my family sick, is more than enough for me. And I recommend that people seriously consider, if they haven't had the chance to get the vaccine yet, that they seriously consider doing it for themselves, for their families, and for their communities.
Okay, doctor, thank you very much for joining us this morning. For more information, anyone can head on over to hartfordhealthcare.org/vaccine. Thank you for your time.
Thank you for having me.